All right, welcome, Dr. Maya Kinzigler of Monarch Family Chiropractic. And I'm so glad you're here with us tonight. We are talking about the difference between adjustment versus manipulation. And I think in order to understand that language, it's nice to just circle back to chiropractic and the umbrella of care that we fall under. So first, I want to look at our traditional healthcare system. Okay. Traditional healthcare falls under something called pathogenesis, which is the study or the birth of disease and the rendering of treatment based on that disease. So when you walk into a medical doctor's office or osteopath or a PT, I would say most PTs who fall under traditional healthcare, who are taking insurance, they are looking at you as a diagnosis. What is your condition and what's the appropriate treatment to address that condition? Really looking at you through a lens of disease. Okay. Chiropractic falls into a very different realm. Our realm is categorized as salutogenesis. Okay. Which broken down means the birth of health. So when somebody walks through our doors, we're looking at somebody in terms of what is keeping them from expressing health. Okay. How can we support a body to experience a higher level and expression of health? Very different. Okay. We're not looking at a disease and diagnosing and treating a disease. We're looking at health and caring for a person to bring them back to health. Okay. And we have something within our bodies that is called innate intelligence. Okay. So that's where we all came from two cells that made one, then two, then four, then 8, then 16, 32, 64, so on and so forth. The spark of life. And the very first organ to form in utero was your brain. And your brain was in control of development, in control of function from day one till last day of life. The only thing fully encased in bone. Okay. So the way the brain processes information is through all sensory input. What we hear, what we taste, what we smell. Also, how we're moving is huge. And then the visual input. So if we have distortion in any of those sensory inputs with how it's fed to the brain, if it's not great information going in, it's not great information going out. So the going out information is any symptom we could be experiencing. A headache, neck pain, low back pain, low energy, poor sleep, fatigue, trouble with digestion, constipation. All of those signals are your brain's way of telling you something's going on. You need to do something differently. Okay. So if we take headache as an example, who walks into a model of pathogenesis, they're looking at the headache as a disease and treatment of the disease. Okay. They're looking at an outside-in approach. What can we give you from the outside to take away the symptom? Chiropractic, very different. You come in with a headache and we're looking at what's going on the inside. How is the system stressed from the inside? We remove that stress and you have a different expression of health, right? So you see people who get adjusted and they notice, oh, I feel better. My headaches went away. Oh, my balance changed. Oh, I'm sleeping better, right? You have a slew of experiences that aren't all the same. But again, we're taking stress off of a system to allow for a higher expression of health. Okay. So I've got this is funky here. I'm sorry. I've got my safety pin because I just think the safety pin is just the best way to explain chiropractic. And thought maybe I could take off this funky background, but I'll just have to deal with it. So again, the first organ to form in utero was the brain. So the top of the safety pin is our brain. The lower portion of the safety pin is the body. So we have this constant communication loop of, input into the brain and then output to the brain of the body. And we want to make sure that signaling is free and clear of interference. And so what is chiropractic looking for? We're looking for a disconnect. Okay. When this safety pin is disconnected, it means that there is a difficulty with this feedback loop. Okay. So when we're looking at correcting that, we call that the adjustment. okay? Adjustment's very different from manipulation. We're going to get into that in a second, but I wanted to give you the background here. I want you to think about a subluxation as the fuse has gone out, okay? It is a brain signaling problem, okay? Has a fuse gone out in your house? What happens?
Lights go out.
Yeah, lights go out. Power is out. We're concerned about, food spoiling. If it goes on longer than, I don't know, 6, 10, 24 hours, right? So I want you to think about a subluxation as a fuse is going out. We want to reconnect that connection and you have power, right? Power's on. So let's get into my PowerPoint. Thanks for indulging me to give you just really the basis of information for understanding adjustment versus manipulation. Okay, so we're going to go to first slide here. Let's go here. Here we go. Okay. So manipulation. I first want to give you the definition of manipulation that Webster Dictionary gave us. Manipulation, the action of manipulating something in a skillful manner. Okay. To treat or operate with or as if with the hands or by a mechanical means, especially in a skillful manner. So manipulate a pencil, manipulate a machine. To handle, manage, or use, especially with skill in some process of treatment or performance. And lastly, to examine or treat by skillful use of hands, as in palpation, reduction of dislocations, or changing the position of a fetus. So as I'm reading through these multiple definitions, something that is coming through with all of them is there is a skillful component to it, right? There is an expertise involved in manipulation. There is some training involved, some understanding of how a machine or whatever is in your hands, how you are utilizing or using that. Okay. I also see the word treatment show up in multiple definitions. Professionals who use manipulation as a form of treatment. This is osteopaths, this is physical therapists, this is acupuncturists, this is massage therapists, physical trainers, Pilates, and yoga instructors. So all of those healthcare professionals or, wellness professionals will use the term manipulation. Okay. And it's using a skillful, in a skillful manner to manipulate or treat an area. Okay. Let me go here. So continuing with manipulation. So this came from the Guide to Physical Therapist Practice. Physical therapists do not perform adjustments. We do, however, utilize spinal and extremity manipulation, along with other manual therapy techniques and exercises in the treatment of neuromusculoskeletal pain and dysfunction in order to restore mobility within these systems. Okay. We're going to go back to that, restore mobility within these systems. We do not utilize manipulation to manage, co-manage, or prevent diseases or conditions in the other body systems. So when I'm looking at this, we're looking at the musculoskeletal system, okay, and mobility. Using osteopathic manipulative therapy, your DO can effectively treat your muscles and joints to relieve pain, promote healing, and increase overall mobility. So in simplest terms, if there is restriction, if there is rigidity, if there is poor movement, the goal of manipulation is to introduce movement in a skillful way. So if I've got knuckles that are not moving well, I can skillfully manipulate my knuckles and crack my knuckles, right? I can get cavitations and pops. That is a manipulation, right? Now, based off of what I started with is understanding chiropractic care and what we're looking for in terms of subluxation, there are indicators that would present potential for subluxation. But did I ever mention anything about tightness of muscles, mobility, restriction? No, I was talking about the brain and reducing interference to this signal between the brain and the body. Okay, so when we're talking about manipulation versus adjustment, there is a very clear difference. And physical therapists said it from their guide. We do not do adjustments. So what we do is very distinct and different from, somebody who is in physical therapy or osteopathic medicine, who is again looking at treating a muscle and joint to relieve pain, promote healing, and increase overall mobility. Again, we don't fall in a model of treatment. We fall in a model of care. Okay. And within care can be components and timeframes of treatment, but bigger picture, we're looking at care and supporting a body to better express health and vitality in life. Okay. So let's see what I got next. So chiropractic. Chiropractic is a philosophy, science, and art of things natural, a system of adjusting the segments of the spinal column by hand for the correction of the cause of dis-ease. Okay, so that's telling us what it is, how it's done, and why it's done, which again, how I started off the workshop tonight was really giving you a 5-minute abbreviation of chiropractic and the philosophy and how we approach the body in healthcare, right? And chiropractic is made up of 33 principles that go into detail on our philosophy. The major premise being there's a universal intelligence in all matter and continually gives to it all of its properties and actions, thus maintaining its existence. Right? So this table is this table because of, the matter and the properties of it that's continually maintaining its existence. We are very different, right? We're life. But again, when I go back to the universal intelligence and within us, the innate intelligence, we are working with an intelligent universe and an intelligent being and ecosystem to support a higher expression of health. That is so much more than the muscles and bones and ligaments and tendons that make up this body that we have. Okay. So when we're talking about an adjustment is very specific to correcting the subluxation. Okay. Chiropractic, doesn't matter what profession you are in, there is very specific verbiage to each profession. Adjustment and subluxation is very specific to chiropractic. If you go outside into our allopathic model, subluxation is very different to them than it is to us. Okay. And you saw that physical therapists don't recognize adjustment in their language because it's not something they do. So the adjustment is very specific to correct the subluxation. And if we break down the word subluxation, it basically means less than light. So again, you think about the subluxation, the disconnect, what's happening is decreasing that signaling. When you have a clear and free signal, you are expressing your highest potential, and you reduce that signal, that lowers that light. So subluxation less than light, and it's moved from center. Okay, so it's malaligned. So the goal with the adjustment, the intent is to restore function, thereby enhancing the expression and optimizing your health potential, which is pretty cool when you think about it. And there's actually an equation for an adjustment. Okay. I love this. So there was somebody in the chiropractic profession who studied thermodynamics, neurology, and biomechanics. And this was the equation that they came up with for the adjustment. So let's start with this first half, this left side. So you've got C sub P plus C sub D. So C plus C sub P, consciousness of the patient. So right away, when an adjustment is being delivered, when we see this consciousness of the patient show up, that means that you play a role in your adjustment. What is the consciousness of the patient? When you're laying on that table, about to receive an adjustment? Are you just wanting to get out of pain? Do you want to move better? Do you want to have better energy? Do you want to get back to doing the things you love to do? Do you want to express a higher level of potential? Do you want to move towards what you could experience? The possibility, right? So right there, as I'm talking about it, is a range of what your consciousness believes that you're there for, right? Pain tends to be lower energetic states versus a higher energetic state of thinking about your potential, what could be, where you could be 30, 40, 50 years down the road, doing more than what you're doing now, being more than what you are now, right? So there's a range there and where you could be. Plus the consciousness of the doctor. So where is our headspace when we're laying hands on you? And if we're talking about the weather, or we're talking about how the Broncos are doing, or we're talking about how cute your sweater is, well, then turn around and say, Doc, I want to experience my highest potential. Why are you talking about them? And we love you. I'm telling you, we love everybody who comes here. So we want to connect with you. And that's not the time, right? So if we get out of the sacred space of the adjustment, feel free to say, hey, Doc, I want you thinking about me, right? Because that's where we want to be and operate. Because whenever I lay my hands on you or you or you or you or anybody on, the line right now, I want to be thinking about bringing you to a place of total connection, a highest expression of health in that moment so you can be your best self moving forward. You never know what an adjustment can do to reconnect this for you to better process, to change the effect. There's been times I've been adjusted. I literally feel like I just got 10 hours of sleep. Like it's just a different experience, right? That's just one of them. Times the force of the adjustment. So when you are delivering an adjustment, okay, whether it's through instrument or hand or table, we're adding a force into the body, okay? Plus coherence, so that green C, coherence. I want you to think about your body as trillions and trillions of cells. And we want those trillions and trillions of cells working as one, kind of like a school of fish, right? School of fish, you have hundreds of fish, thousands of fish, and yet they're moving as one. They're individually separate, but they are together an entity. Or think about in a symphony or an orchestra, each individual instruments, but together, I mean, you've all heard them tuning up. You're like, that does not sound good. I don't need to hear the clarinets while the saxophones are tuning and what's going on with the drums over there, right? But when they're working as one, they create this sound and this melody and this feeling and experience of music, right? So we want to increase that coherence within your body of those trillions of cells, minus entropy. Entropy is chaos within the system. We have cells that are abnormal. We all have a portion of our body of cells that are, doing abnormal things. And your immune system's job is to take care of it, clean those up. In fact, when you get enough cells doing abnormal things in the body, you know what they call that? Cancer. So it means that your immune system is not doing its job to clean things up. There's dysregulation. There is incoherence. There is entropy going on within the system. So the goal of the adjustment is multifaceted, and you play a part in it, just like we do too. And the intent and the intention of laying our hands on you is a sacred thing. So that's where we want to make sure that we are totally present and engaged to support your high expression of health and connection, not just by helping support better movement and mobility, but supporting your power being on so your brain can do its thing. So here are the things that research is showing when you get an adjustment. So we see improved or altered visual acuity and visual field size. So we see change in your vision. Reduced joint position sense error, meaning your brain's ability to know where your arm and leg is, even if you got your eyes closed, right? Like my arm is behind my back I can't see it. I just know it's there. It's the sixth sense, the proprioception, like your brain's ability to understand where your body is in space. Decreased reaction time, meaning if I'm going to throw you a football or a baseball, you're going to be, your reaction time is going to be reduced. You can respond more quickly. Altered brain processing, meaning you're receiving better sensory input for your brain to process differently. Changes in the way that our brain integrates sensory and motor information, altered spinal cord reflex excitability. Now, do you want our spinal cord, right? Part of the central nervous system. Do you want that excited? Do you want to be giving it and eliciting good sensory input into the spinal cord? No. You want that spinal cord totally relaxed, at ease, right? You do not want that thing excited. So it's actually reducing and altering how that spinal cord is receiving information and its excitability. Changes to specific messages that get sent to muscles from the central nervous system, muscle strength in the legs, and it's reducing or preventing muscle fatigue from developing. So as I'm reading through this list, you can see why professional sports teams like chiropractors on their staff to adjust their athletes before and after performance. You know, what I do want you to be seeing here is that, holy cow, what we're seeing is the adjustments changing the brain. It's not about your muscles. It's not about your bones. It's about the brain. And what we see with an adjustment is it's changing the brain, which is really awesome. See what I have for this last slide. So I'm going to go here, and then some of you maybe have heard my story. I feel like it's a nice segue to really understanding how the adjustment can change the brain. But we've used these terms treatment and care, and I just want you to understand that when you go into a medical model and they're looking at your concern, whether it's headache or low back pain, their main goal is to treat and mitigate that diagnosis. And once they've treated that, mostly from an outside-in approach, they're releasing you from treatment. But if you don't change what's happening on the inside, the treatment is going to potentially have to take more invasive and more serious resolutions down the road, because your body continues to give you worse and worse, challenges and problems if you don't address it, right? When somebody comes into a chiropractic practice, they're most of the time in pain. So yes, we are looking at how can we support a body resolving and managing the internal environment so they express things differently, so they feel better. And yet, feeling is a tip of the iceberg. It's the last thing that shows up. So once we get through that short term, what we'll call treatment, to really help support somebody managing their symptoms and getting to a place of pain relief, that's where the real work starts. That's where care starts, okay? Care, the provision of what is necessary for health, welfare, maintenance, and protection of someone or something. So feeling is very, sometimes we say it's the worst thing somebody can experience is feeling better, because that's when they stop doing the things that are most right for their health and well-being. So a lot of you are on care plans. A lot of you are on care plans that we recommended 12 months. Did you feel bad at that entire 12 months? I hope not, right? That's why we do re-exams, to really assess where you are. But a lot of times people feel better in the front end, and that's where we could call that treatment. But the care is the work that you're doing, in the long haul, to help support a brain better processing the stress of life. And we are all a cumulative, how I'm presenting today is a cumulative, impact of life in my 4+ decades, right? And I know that the next 4+ decades, I don't want to be slowing down. I want to continue doing those things. And we all know somebody who is healthier in their 60s than they were in their 40s. And likewise, you know, somebody who's 40 who looks 60, right? So we want to support the highest expression of health. And this is where I'm going to end. So some of you may know I'm a chiropractic kid. I've been adjusted all of my life. I thought it was ordinary. I thought it was an ordinary thing. I thought everyone got adjusted. Like, I don't remember what age I was, and I thought, you don't get adjusted? That's weird. I thought that was weird. I'm finding out I was weird, right? But I can remember getting adjusted in the middle of a football field right before I ran a 200-meter dash. I can remember getting adjusted when I was sick. I remember asking, hey, Dad, can you check me? I worked in his clinic for 5 summers. It was just part of my life. First adjustment, day 1 of life. And when something is so ordinary to you, you don't realize how extraordinary it is to be in that space and have that upbringing. But about 9 years ago, I woke up with numbness and tingling on the left side of my mouth. And over a 10-day period, it expanded to the left side of my face, left side of my body. I started having slurred speech and double vision. I walked into the office, Martin Luther King Day, and the person who worked for me at the time said it looked like I was on cocktails because of how I was talking, how I was moving. My husband showed up the noon hour to take me to the emergency room to rule out aggressive brain tumor, stroke, some neurological condition. Went to the ER, CT, MRI, blood work, all the things. They basically told me I have MS, but I need to go to the neurologist for the definitive diagnosis. They wanted to keep me there overnight. I said, no, thank you. And I told my husband to get me to my chiropractor because I knew that my body was having trouble expressing health. My speech was so slurred after that emergency room visit, nobody could understand me. I went to the chiropractor, he adjusted me that night, and my speech improved immediately by 50%, with something going on up here. And that began my journey of coming back to health because I was confined to my bed most days. Husband had to get me dressed in the morning, had to, sometimes feed me. And I was getting adjusted every day. I got very structured on my nutrition, did acupuncture, life coaching. I was thinking of everything I could do to support a higher expression of health. Meanwhile, I went to the neurologist and they said, yes, you have multiple sclerosis, but it's one lesion. To have multiple sclerosis, you need multiple. So you basically have single sclerosis. We want to do a definitive diagnosis, which is a spinal tap. Okay. Spinal tap, they pull out your cerebral spinal fluid. If you have inflammatory markers within that fluid, you have MS. So I said, okay, let's do it. They said, well, we want to talk to you about potential medications and how to mitigate this. Meanwhile, 5-6 weeks in, I started noticing I was improving. It took 5-6 weeks for me to notice I was improving. Probably 12 weeks. 12 weeks, I totally resolved. Back to 100%. My spinal tap came back negative. I am considered a medical miracle. My healthcare team wanted to run all sorts of tests because they wanted to figure out what it was and make sure I get the appropriate treatment. That is not how we address health, Dr. Kristen and I. Not in this office. Number one, I don't want a label. I don't want to be put in a box. I don't want somebody to tell me what my potential is in terms of expressing health. And thank God I knew the things I knew to do. I was brought up in a chiropractic home, went to chiropractic school. Everything that I have learned and was taught to that moment set me up to think differently about how to approach my health in that time. Because if you know anything about MS, the outcome is that by 50, 60, you're in a wheelchair. My husband, who married me 6 months prior, would be a lifetime caregiver. Who knows if I'd be able to have children? I have a daughter now who's 3. And I would put my hope in medicine to come up with the next miracle drug for my diagnosis. What can I do from the outside in? And I'm not saying that you don't need medical care because we need it. But we also, or I should say, and we need to do things differently for our health. And we need to start thinking about the amazing intelligence that is within, that is expressing itself right now, and why it's expressing itself that way. We all have a story and an experience. So give yourself some grace in where you are, and know that you have trillions of cells whose only job is to work for you, to express a health and potential, because all they want is for you to survive and live. And that's what chiropractic does. We help support a higher expression of health from the inside out, and we do it through the adjustment, not to just get better mobility, feel better about how your muscles are moving, but have a higher expression of health. And I just think if I didn't know what I knew then, if I carried that subluxation on that, changed my speech in that way, who knows what my potential would have been and how my recovery would have been if I wasn't doing what I was doing. So thank you for indulging me and sharing that. And I really, my hope with sharing this workshop tonight is, number one, you have better understanding of your care in this office, but number two, that you have this lens of looking at your body in a way that you are a miracle. I mean, each of us are. If conception happened at a different time, or, it was that one egg and that one sperm. It could have been a ton of different sperm, different sperm to make up somebody else. You are a miracle. And we just look at it. Your body needs no interference to create a higher expression of health. So I love you. I appreciate you. Thanks for being here tonight. Next week, we're talking about understanding the developing brain, which is why we love seeing kiddos in here. I would love to hear your takeaway when you're in the practice next time. We love you. So Dr. Mayakin of Monarch Family Chiropractic, and we'll see you when you're in the office.